And fake news regarding COVID-19 in this instance have left a lot of people confused, flummoxed, and skeptical, if not totally pessimistic, about the existence of this virus. We have been bombarded with convincing pseudoscience and downright laughable conspiracy theories. What is fake news? Fake news, as defined in Bodleian Libraries of the University of Oxford in a book titled The Science of Fake News by David M.J. Lazer and others, is a charge often applied to information that someone doesn't like or disagrees with in order to discredit it. But fake news is not simply uncomfortable information. Fake news is fabricated information that mimics news media content. Fake news is a topic we are already working on at LATV Productions, and you'll be best to subscribe to LATV Productions channel on YouTube as soon as possible so that you'll be the first to know and notified when this eventually drops, as we say in media and entertainment terms. Why have most of us become so gullible to fake news and receptive to the most senseless claptrap? Is it due to anxiety? Or the fear of the unknown? Or what? It has even become worse with this holiday forced on us by the government due to the coronavirus attack. As we are being assaulted with such a salvo of information, we get more and more confused rather than saved as we struggle to decipher which ones are really true or otherwise. Instead, we end up with stress, poor mental health, and further puzzlement. Some people are even saying there is no virus at all out there, but the handiwork of the government. Some say it is the new technology, the almighty 5G. Even religious leaders are divided in their beliefs and tenets. You will hear some of them claiming that it's an act of God, while some will castigate them and call for their heads, saying that God does not have hands in evil things. There are overwhelming conspiracy theories making the rounds out there, scaring people stiff and making us want to jump out of our skin. A very close friend and big brother won't even pick my calls again, just because I tried to sway him from the alleged belief that 5G is a culprit of the so-called prevailing pandemic. He unpersuasively believes there is no COVID-19, but a government conspiracy effort to cover up the effects of 5G technology on us all. At some point in some quarters, these rumors, myths, unfounded revelations overtook the facts and the truth about this latest pandemic. Some rumors are even more noxious than the celebrated COVID-19 itself. This program edition has been put together to make life easier for you in understanding which of the things you've heard about coronavirus and COVID-19 are actually myths, scams, conspiracy theories, and the truth. As we say in my Yoruba language, "Igbadun ti ni wàhálà tiwa." That is, it means your viewing pleasure is our own distress. And also, how you safely sift through these barrages of information to get to the truth is our distress in the same vein, because we do care about you. I will therefore try as much as I can to put the record straight through our own research and investigations at LATV Productions to seek the truth before these fake reports flying around do as much damage as the virus or even worse. The truth, they say, shall set you free. All right then, let's get down to it in earnest. I am Larry Adego. Do not touch packages and mail from abroad, especially China. False. It is claimed that the viruses live and survive on parcels and packages from China for many days. This is not true, as the World Health Organization (WHO) has refuted this after confirming in its studies how long the virus can live for and on different items. It is therefore safe to receive mail from China and other parts of the world with no or minimal risk. I quote, "Even though the new coronavirus can stay on surfaces for a few hours or up to several days, depending on the type of surface, it is very unlikely that the virus will persist on the surface after being moved, traveled, and exposed to different conditions and temperatures," World Health Organization said. Coronavirus stays on different surfaces for different periods. A good sanitizer can destroy its effect within 30 seconds of applying it. Soap and water will do a better job than sanitizers. On the frequently asked questions section of the Centers for Disease Control and Prevention (CDC), it is stated that, and I quote, "Because of poor survivability of these coronaviruses on surfaces, there is likely very low risk of spread from products or packaging that are shipped over a period of days or weeks at ambient temperatures," unquote. Some people even think that consuming a lot of alcohol, ethanol, and hard drugs will kill COVID-19. This is false. In fact, alcohol does more damage than good to your health, as usual, if abused. A lot of people have died for taking to this advice. For example, the official news agency in Iran reported that 16 people died from methanol poisoning after taking to this deadly advice. The best choice of alcoholic drinks, marijuana, or cocaine will not cure or prevent COVID-19, period. In the fact sheet titled "Alcohol and COVID-19, What You Need to Know," posted on its website, the World Health Organization states that, and I quote, "Alcohol use, especially heavy use, weakens the immune system and thus reduces the ability to cope with infectious diseases." It says further, and I quote, that consuming any alcohol poses health risks, but consuming high-strength ethyl alcohol, ethanol, particularly if it has been adulterated with methanol, can result in severe health consequences, including death. Alcohol may even make people more vulnerable to COVID-19 as it is connected to a number of severe diseases. Can I use vodka as hand sanitizer? The answer is no. Please don't. The CDC advises that hand sanitizers should contain at least 60% alcohol. Vodka usually contains between 35 and 46% of alcohol. Hand dryers kill COVID-19. False. Hand dryers are what they are called and nothing more. It is the proper hand washing process that is the best prevention advocated by professionals, including the World Health Organization. Wash with soap and water frequently and for about 30 seconds every time. See my video on how to wash your hands properly after this. It is best to dry your hands with paper towels or air dryer, as germs lurk in cotton hand towels. Spraying your body with alcohol and bleach, chlorine, will scare COVID-19 away. This is not true. Danger. You are putting yourself at risk of catching fire alive by rubbing high level of alcohol on your body. If you survive it, you'll be left with scars for life. The World Health Organization has warned that spraying such substances can be harmful to clothes or mucous membranes, that is, eyes and mouth, and so on. It is safe for disinfecting surfaces under appropriate caution. See our production on YouTube titled "Hand Sanitizers Can Be Very Dangerous." COVID-19 was leaked from a laboratory in Wuhan, China, to cover up 5G network deadly effects. This is false. This is total hogwash. Just like there were wacko theories about 9/11, the Holocaust, the death of John F. Kennedy, and that no one has ever stepped on the moon, there will be more theories in the future. This infection is basically another infection caused by a virus that transmitted from animal to humans, referred to as zoonotic infection. Other examples of zoonoses are Ebola, the Spanish flu, and HIV. Any hand sanitizer can protect you from infection. This is not true. If the alcohol content in your sanitizer is less than 60%, forget it. The World Health Organization stipulates that sanitizers should contain at least 60% alcohol or more. Moreover, hand sanitizers are for very temporary measures, like for when you could not reach your soap and water. If you do not cough or have feverish conditions, you do not have COVID-19. This is not true. Although coughs and fevers are probably the most common symptoms, they are varied and not limited to these. Others include, but not limited to, vomiting, muscle pain, and diarrhea. Loss of the sense of smell has now been included in the symptoms. These can be the only symptoms in a few people. Moreover, while some people come up with one or some of these symptoms in approximately 5 days, others may take 15 days before the symptoms show up. In a study, it is found that during the first 5 days, while an infected person still feels perfectly fine and classified as being asymptomatic, that is, without symptoms, is when the highest amount of infection likely spreads from person to person. A research suggests that about 30% of already infected people may not show any symptoms at all, while another research found that screening for the virus based on symptoms can be ineffective. This is why many governments clamor for a 14-day isolation and social distancing. COVID-19 is flu. This myth was commonplace when the virus first emerged to downplay its dangers and noxiousness. That is, that it was flu-like and there was nothing to worry about. This was eventually proved wrong, as, yes, coronavirus can attack and kill from any age group. The percentage of coronavirus cases that end up in hospital is 19%, while that of flu is only 2%. The time spent in hospital with coronavirus is about 10 days more than that of the flu. Coronavirus has a much higher rate of spreading than the flu. While flu has been around for more than 102 years, we have built some immunity to it. Despite the immunity, a lot of people still require the yearly flu jab as this virus mutates continuously. Whereas, we have yet to come up with a World Health Organization finally approved vaccine for this newly emerged virus named COVID-19. Therefore, COVID-19 is not the flu. COVID-19 threat to humans is greater compared to the flu. The CDC estimates about 140,000 to 810,000 people get hospitalized with flu yearly in the US alone. The flu kills more people than COVID-19. This is not true. Let's use the United States of America as an example. Between February and April 2020, more people have died from COVID-19 than the number of people that have died from flu since October 2019 to April 2020. That is, COVID-19 has killed more people in 2 months than the flu had in 6 months since the beginning of the COVID-19 pandemic. According to the CDC, it is estimated that between 1 October 2019 and 4 April 2020, 24,000 to 62,000 Americans lost their lives to the flu. COVID-19 is more deadly than the flu, as 1, it is twice more contagious, 2, it can be asymptomatic for many more days than the flu, and 3, a vaccine is already available for the flu. Being young and having no health problems minimize the risk of COVID-19 infection. While being young with no underlying health problems might put you in the lower risk category, you can still be infected with COVID-19. In a United States of America study of over 500 COVID-19 patients, 1/5 of those admitted to hospitals due to serious complications were aged between 20 and 44, while the same fraction of people between 20 and 64 years died. Pneumonia is one of the most causes of hospitalization in patients with COVID-19 to date. Therefore, the chance of dying through COVID-19 is not based on being of old age alone. People with such conditions as diabetes, cardiovascular disease, hypertension, and asthma, including cancer and weakened immune systems, have higher risks of infection. An example of such was the late 21-year-old male footballer, Francisco Garcia, who was diagnosed with both pneumonia, said to have been caused by COVID-19, and leukemia. Before his hospital checkup trip, Francisco never knew he had either disease.
May his soul rest in perfect peace.
It will have been better to let everyone get infected with the virus, as this will cause less death than it has so far. Did you hear that? This is very untrue. There is a strategy like this called herd immunity. Many people will get infected with the disease and over time boost a natural immunity for it. Some leaders, including the UK Prime Minister, Boris Johnson, insinuated this strategy. If everybody caught this virus without any strategy to curb it, it will cause more deaths. Some Imperial College scientists believe this will have led to the death of about 250,000 people within the UK compared to the present 40,000 or just about so far. Not to mention the economic, healthcare, and societal breakdown and unimaginable impacts. Social distancing is a waste of time. The present mortality rate is 8 deaths to 77 hospital admissions per month. Studies have shown that if places like restaurants, churches, mosques, and gyms were allowed to continue to open, the infection rate will have been about 20 times more. It is also stated that the best way to keep infections to the minimum is through social distancing. A person carrying the infection without knowing will have in a month infected an average of 406 people, while the 406 people would each have infected another set of 406 people. The virus will all clear up totally in a couple of weeks. We've had this for weeks on end. Sadly, this can never be the case, considering the history of other viruses before it, and the fact that it has reached too many countries already. The best way to minimize its effect now is to keep infection rates down through social distancing and wait for the vaccine. That's it. as advised by professionals and the World Health Organization. The book, The Eyes of Darkness, written by Dean Koontz about 40 years ago, predicted this outbreak. No, the 1981 fiction novel says that, and I quote, a severe pneumonia-like illness will spread around the globe. Although the latest editions of the book refer to the outbreak as Wuhan 400, the first publication of the book, that is the original version, called it Gorky 400, referring to a place in Russia. It was changed to Wuhan 400 from Gorky 400 in the latest edition. Moreover, it is man-made in the book and with a mortality rate of 100%. In reality, it has been confirmed that COVID-19 is zoonotic, that is, it was transferred from animals or animal to humans. The mortality rate is much less than 5%. Can high or low temperature kill coronavirus or COVID-19? Generally, coronaviruses survive for shorter periods of time at higher temperatures and higher humidity than in cooler or dry environments. However, there is no direct data for this virus, nor is there a direct data for a temperature-based cutoff for inactivation at this point, says the CDC. It is worthy of note here to say that even in high temperature areas in summer, like Australia and Singapore, COVID-19 is active. You can catch COVID-19 no matter how sunny or hot the weather is, says the World Health Organization. I don't need to self-isolate as I don't have COVID-19 symptoms. This is not true. In a study in China and published in a journal called Science, about 4 in 5 people with confirmed COVID-19 infection were very likely infected by people who did not know they had it. Another instance was the spread of the virus on the Diamond Princess cruise ship in March 2020, where nearly 50% of the COVID-19 infected people on the cruise ship were asymptomatic. That is, once again, they tested negative and they also had no symptoms. Some latest studies still acknowledge that between 25% and 50% of infected people are asymptomatic. Let me say that again. Latest studies revealed that 25 to 50% of infected people show no symptoms and spread on the disease without knowing. Does this pandemic have anything to do with the 5G network? No. 5G, for those who don't know, is the next generation of wireless technology network. Just like the 1G, 2G, 3G, 4G, and then the 5G. The chairman of the International Commission on Non-Ionization Radiation Protection, Eric Van Rongen, said in an email to CNN that the theory that 5G might compromise the immune system and thus enable people to get sick from corona is based on nothing. Can mosquitoes transmit COVID-19? As at the time of putting this film together, there was no evidence available to us to prove that mosquitoes can cause COVID-19. The new coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. Is it possible to be infected by COVID-19 more than once? There seems to be no specific answer to this at the moment. Scientists think it's too early to be able to know. Some countries have been spraying public places with disinfectants. Why is the United Kingdom or the US not doing this? Health experts have said randomly spraying open places is basically a waste of money, time, and effort. The WHO, that is the World Health Organization, claims it can actually do more harm than good, as spraying disinfectants can result in risks to the eyes, respiratory, or skin irritation. It says further that spraying or fumigation of outdoor spaces, such as streets or marketplaces, is also not recommended to kill the COVID-19 virus or other pathogens, because disinfectant is inactivated by dirt or debris, and it is not feasible to manually clean and remove all organic matter from such spaces. About half of COVID-19 patients die. This is not true. As earlier mentioned, COVID-19 mortality rate is less than 5%. The Chinese Center for Disease Control and Prevention established in a recent report that about 80.9% of COVID-19 patients or cases were minor, while the WHO report that about 80% of people will only have a comparatively mild infection that requires no hospital admission. Such mild symptoms include fever, cough, sore throat, tiredness, and shortness of breath. Pets spread coronavirus. Presently, there is a one-off evidence to suggest this. In Hong Kong, a dog of the Pomeranian breed has been claimed to have contracted COVID-19, probably from its owner who had the virus. The dog did not display any symptoms. Scientists are particularly interested in this case. A professor of molecular virology at the University of Nottingham in the United Kingdom, Professor Jonathan Ball, says, and I quote, "We have to differentiate between real infection and just detecting the presence of the virus. I still think it's questionable how relevant it is to the human outbreak, as most of the global outbreak has been driven by human-to-human transmission. The real driver of the outbreak is humans," he concludes. You can only be infected if you stay too long with an infected person. While this applies depending on what is meant by too long, it is possible to get infected in no time at all. Is COVID-19 the deadliest virus known to humans? COVID-19 is not the deadliest virus known to humans thus far, even though it seems so. The Spanish flu or influenza killed an estimated 50 to 100 million people within 18 months between 1918 and 1920, and it still kills now. Others, such as Ebola, have higher mortality rates. If I take the flu jab, will it help? COVID-19 is a unique virus like other viruses. Its treatment and vaccine are therefore unique to it. A flu vaccine will neither protect you nor heal you if you caught COVID-19. Is it true COVID-19 is being used to cover up the dangers of the new 5G? Or is 5G being used to help spread COVID-19? One of the most recent theories to emerge is that 5G is responsible for the swift spread of COVID-19 across the globe. There are too many conspiracy theories emerging by the week since the arrival of the latest coronavirus. One of such is that 5G technology can be used by viruses to spread through electromagnetic signals. It is true that Wuhan, where COVID-19 started, was one of the earliest cities to have 5G installed amongst other cities, including Beijing, Shanghai, and Guangzhou, who also rolled out the 5G technology about the same time. This was in 2018. Most of the countries suffering COVID-19 have little or no 5G technology as yet. An example is Iran, which has not installed any 5G equipment. The country Iran is one of the countries with the highest casualties of COVID-19. What does that tell or prove to us? Antibiotics can kill COVID-19. No! Antibiotics do not kill viruses. They can kill bacteria though. It should therefore not be used to treat COVID-19. For more information on this, please see our film titled Coronavirus Explained in Layman's Terms. It's on YouTube. Coronavirus Explained in Layman's Terms. This is on YouTube, on LATV Productions channel. Can garlic and ginger protect you against COVID-19? While some research implies that garlic might retard the growth of some types of bacteria, I said, there is still no evidence of it having the same effect on viruses. Pneumonia vaccine will help protect against coronavirus. No. Pneumonia vaccines cannot provide protection against the new virus. This is a new virus that needs its own vaccine to deal with it. COVID-19 can cause pneumonia, but pneumonia vaccine cannot be used to protect against or treat COVID-19. Vaccines against pneumonia, such as pneumococcal vaccine and Haemophilus influenza type B HIV vaccine, only help protect people from these specific bacteria infections, according to the Harvard Medical School. Is it true that there is already a vaccine for COVID-19, but it is being hoarded and used to treat only the rich people for now? There are many vaccines on trial at the moment, but there is no existing vaccine for COVID-19 yet. It usually takes many months, running into a year plus, to develop a right vaccine for a newly emerging or new virus. The World Health Organization is managing many drug manufacturing companies in their efforts to develop and access vaccines to treat COVID-19. Some are already in their clinical trial stages. There are some alternative medicines out there already to treat COVID-19. As at the time of publishing this film, there has been no alternative medicine endorsed by the World Health Organization to treat COVID-19. However, those infected with the virus should receive appropriate professional care to relieve and treat symptoms, and those with severe illness should receive optimized supportive care. Some specific treatments are under investigation and will be tested through clinical trials. The World Health Organization is helping to accelerate research and development efforts with a range of partners. Well, there you have it. I do hope you've been able to enjoy our program once again, and that we've been able to help you to keep your mind at rest while you do the right things. To me and to us at LATV Productions, we believe that COVID-19 is still about, and we are not yet fully out of the woods. Just like before, with other viruses that have attacked us before, like Ebola, COVID-19 might leave some traces or trickles behind because we are still treating the flu up till now. Therefore, from LATV Productions, we say, please keeping safe.